Good morning, happy Thursday, MD Monthly. We're back with your favorite segment, Ask the Expert. Today we're with Dr. Marc Taylor, plastic surgeon, board certified. We're going to be talking about all things facelifts, neck lifts, natural fat grafting versus off-the-shelf fillers, treatments for wrinkles, and sagging eyelids. How are you today?
I'm fine, thank you.
How's your week so far?
Well, so far it's going well.
We're excited to have you. I know you've been in practice for over 30 plus years. Tell me a little bit about the procedures that you specialize in.
Well, I'm a plastic surgeon, been in practice here over 30 years. I have done all types of plastic surgery over the years, but now I focus mainly on the head and neck.
The head and neck.
Cosmetic surgery, mainly facelifts, eyelid surgery, lasers, fillers, whether it's the synthetic or the natural fat, and brow surgery, but a lot of neck and face surgery as well.
What type of clientele do you normally see? Do you see more female or more male, and is there an age range?
Well, predominantly female.
Female.
Probably around 70, it depends, time of year it varies, but it's usually at least 70 to 80%. But more men are getting procedures done. They tend to have the smaller procedures.
The smaller ones.
Well, what I mean is the eyelids or the fillers, that type of thing. But we are seeing more men that are having a lift type of procedure or something done on their neck.
Mm-hmm. And remember, if you have any questions, leave them in the comments below because we're going to be answering those here just a little bit later. First, let's get into facelift. So what exactly is a facelift for those who don't know?
Well, a facelift classically is to lift the face.
Mm-hmm.
Everybody stands in front of the mirror and pulls his back. And of course, when you do that,
so if I pull it back in the mirror, is that how I'm going to end up looking at the end?
No.
No?
We wish, but I mean, in some cases, yes. But most people, especially as you get up in age, when you're pulling up, you're pulling not just the skin or a part of the tissues that we can operate on. You're pulling all the structures, the ligaments, and the muscles up. So a facelift deals mainly, it's a type of surgery that we use. We have incisions hidden under the chin here, and then we hide them around the creases around the ear. We don't go behind the ear much anymore. We used to. Mm-hmm. But it's really an approach to take out extra fat in the neck and the face, to tighten the muscles in the neck and the face, and take out as many of the wrinkles as we can, and take out excess skin.
So is there only one type of facelift, or are there different types, and are they all the same?
No, it's like hitting a tennis ball or playing whatever sport. There are a lot of different ways to do it, and there have actually been medical studies where they've taken twins and let one plastic surgeon in one city operate on them, and another operated on the other twin, and they've compared this.
And they came out
different. Yes, very little difference, if any. So there are a lot of different ways to do it. The basic components to a facelift are, as I mentioned, we make an incision here, incision around the ear, undermine the skin, bring up the tissues, tighten the muscles, take out extra fat, and help get rid of the extra skin and the wrinkles.
So would you say that's the best type of facelift?
Well, it varies from patient to patient. I mean, some younger people really don't need a total facelift. They just need an area. Mm-hmm. So that you were asking about the age range. I mean, most of the people that we see for a full facelift are in that 45, 75-year-old age range. But really there isn't any limit as long as they're healthy. Now we see younger individuals that are in their, some in their 20s, but usually in their 30s, where they have a genetic component to it.
Right.
And they just have some fat, and they really don't need a full facelift. They just need an incision under the chin, we go in and take that fat out and tighten
So it
the
can
muscle.
be minor little tweaks.
It can be minor. There are a whole series of techniques that historically where people just made an incision, for instance, along the ear here, they tunnel down a little bit, and they take some big sutures and pull them up. And that's still, there are products out there that, like there's a thread lift. There are different types of procedures that still do that in that they tunnel down, they use a special barb suture to pull up the tissues. Unfortunately, that technique, it's really for young people. It doesn't work in people that have a lot of sagging skin, and it doesn't last very long. One of the new trends today is they're called Nova threads,
Right.
and they're just a little mini version of the what we call the old quill type of suture. Actually, I use the quill in my surgery a lot. It's a bigger suture though. The Nova threads are little tiny needles, and so you don't need a surgery. You just can thread it down and bring up the
So you
different
just
areas.
stick like a thread down?
Yes.
But does
And
it stay in you or you take it out?
it stays in you. They're dissolvable,
Oh, okay.
and that's kind of the downside to them. They only last anywhere from 6 to 15 months. It depends. But they're using them for not just to bring up different areas of the face, but as a filler for the lips and different areas. And I use them. I like them. They've been in the United States about a year and a half.
So if someone's interested in a facelift or they think they might want one, do they come in for a consultation first? What's the process like for that?
Yes, we
You do a very thorough.
We have to see them before we operate on them. But no, yes, they come in. They can call. We have free consultations, and we come in and they give a medical history, of course, and then we go through what areas of the face are concerned, because a lot of times they come in and they just say, "Oh, I just want my neck done," when really there's so much skin and fat that they just can't
You can't just do
one.
one.
Just do one area. Now sometimes we can, but the techniques we use vary. We don't use a lot of the old style where we went way behind the ear, we tunnel down and
Right.
cut the muscles and bring those up. But we do tighten muscles, take out extra fat, take out extra skin. And so that when they come in for a consultation, we discuss all those factors and the steps that they would have to go through, and depending on their age and their condition, they might not need as much surgery as a full facelift. It just varies.
Is there a age limit to receiving a facelift?
No, not really. I mean, I've operated on people in their 80s. As I mentioned, most of the people are 45, 75.
Right.
But the most important thing is they're healthy.
Right.
Yeah.
And then what does the recovery time look like for a facelift? Are they up and running a week after, a day after?
Well, the swelling and bruising, they're the hardest things to predict. I mean, we have a list of over-the-counter as well as prescribed medications that people should not take. But the bruising and swelling, 80-90% of it goes within the first week. And
That's pretty good. That's
well,
quick.
it just varies. I mean, in turn, we want you up and around. I
Yeah.
mean, the other thing that's different about my practice is I don't use general anesthetics and gases. We don't knock you totally out. We use a sedation, local type of anesthetic like the dentist, and I think it's better for the patients. They're up and around quicker, get that blood flow going. And that's what we want. We want you up and around. it just depends on your job, though, in terms of return to work, because
Right.
you know the bruising is going to go away. It's just a question of when. And sometimes you'll have a little more swelling on one side than the other. But in particular, if someone's in a position where they're either working from home or they're in an office environment where they're not interacting with the public, sitting like you are every day, then
They can have some downtime.
Sure, but they usually can go back to work. I mean, they're in 7-10 days.
And then, do facelifts get rid of all your wrinkles completely, or what can we expect from that? Because I think the idea is, oh, if I get a facelift, all my wrinkles will be gone. I'll be flawless.
That's right. Yeah, you hit the nail on the head, and in that's what the conception is. But the reality is that no. And I we have some pictures of different ways of treating the wrinkles in the face that they can look at later. But a facelift, it will take out excess skin. It cannot change the quality or the nature of that skin.
Right.
And so, yes, it does eliminate some of the wrinkles in that the hanging skin and the excess skin. But the fine, what we call intrinsic or the fine wrinkles in particular, that's where we use lasers and the fat injections to help fill an area, to help fill the underlying tissues to get rid of those wrinkles, or the laser, we take off the old skin on the top.
Let's go into some pictures. I think we have some before and after photos. The first one is a male, I believe.
Yes, the first one's 72, 74-year-old male. And now he's a good example. He had good skin tone, and he just had one area under his chin. He had some extra fat, and all I did was make an incision. We went down, tightened that muscle, took the fat out, and that's all he needed. So he did well with just that, even though he was in an older age group.
I'm glad we're able to show a male before and after, because I think males, they never really think that that's a procedure for them, or that's an option for that issue that they have.
Well, that's true. Actually, that particular procedure where we just take that fat out and tighten the neck, I do see that's probably, I'd have to look at the numbers, but I think that's probably the most common thing that I do for him, as opposed to a full lift.
Right.
And a lot of it's genetic. He was not a genetic thing, but a lot of it is genetic, where they get some fat and they come in, and of course women too. But yes, men come in for that.
Let's pull up the second photo that we have. It's a female this time.
Well, she's a good example of someone where we could not have just gone in and made an incision under the chin. I mean, we could have done it, but it would not have dealt with all her problems. And so she needed incision under the chin, and then we made an incision in the wrinkles around the ear, so that we were able to help define her jawline, take out that extra fat, and tighten that muscle.
And then I think we have one more before and after. Do you want to kind of explain the procedures you did for this lady?
Well, this is just an example of someone. She's a relatively young woman, but she has a fair amount of fat in her neck, but she also has heavy skin. And so she's another example of someone that we couldn't just go in through the neck. We had to come around the ears, and it really helps tighten that neck muscle and to get rid of that extra fat and bring up that and get rid of that extra skin.
Awesome. So remember to leave your questions in the comments below. I think we have a couple right now. I'll go ahead and pull those up. So Janine, thank you for watching, Janine. She said, what is the recovery time for a facelift? I think we kind of went over that a little bit already.
Well, yes, as I mentioned, it depends on how much interaction you have
Right.
with the public. Your again, we want you up and around. You're a lot of times you're, the first couple of days we just have you take it easy. We don't want you doing too much. It's the head movement that can create problems, and so we really have a wrap around you, big kind of gauze wrap. We have you sit with your head up, keep ice on. But after 3 to 5 days, we want you more active. But we take the sutures out in about a week, and then you have to be careful of things like the sun, and you have limited activity, and that we don't want you doing a lot of head movement,
right,
playing tennis or anything like that. But you can, in terms of going back to work, it's usually 10 to 14 days that most people.
That's pretty short recovery time.
Yeah.
Dr. Macias, hi, thank you for watching. She says, on the Nova threads, how often do you need to come back, or is it done once? How much is this procedure? So the first part.
The price, I'm not sure of, to tell you the truth. And I'm not trying to avoid the question. I'm not sure the price, but it's considered kind of an alternative to fillers, but it also, and the reason why I say that is because they have the Nova threads where you can use them to fill an area,
right,
the cheek or whatever. But the unique thing about the Nova thread is that it has that quill. It's like a fishing line that has little barbs on it, and it goes in and you can pull it up, and that's the idea behind it. And so it lifts certain areas, and it's many times used in lieu of or instead of fillers. So, but they are made out of it's a dissolvable type of suture.
So after it dissolves, do they come back?
No.
No.
I mean, after it dissolves, we really don't have a lot of studies in terms of how long the lift part of it lasts. There is a permanent component to it to some degree. It's just how great and how long that lasts. We don't really know. I mean, they've been doing it in Europe longer, but there are not a lot of studies. And
right.
But it's, again, as I mentioned earlier, it's anywhere from 6 months to 15 months.
It's a pretty good time.
Yeah.
Okay, we have another question. Angelica says, I am 43 years old and I feel my neck/upper chest area is aging faster than my face. What I mean is I see more wrinkles, especially when I get up in the morning because I sleep on my side. What do you recommend besides sunblock and moisturizer? Is there a surgical procedure that can iron that out?
Well, it would depend, but yes, if you always want to use the sunblock, but
right.
but if she's talking about sun damage, then yes, the laser works well on smoothing wrinkles, getting rid of sun damage. Some of my happiest patients are women that I've lasered their neck and upper chest. They've been able to. I mean, a lot of times with severe sun damage, it takes more than one treatment, but it helps. They've been able to change their whole wardrobe. If she's talking about a lot of loose hanging skin, well then that's a separate issue, in that she might need a surgical technique, either a lift or a neck lift. But even with surgery, sometimes we still have to do the laser, especially down lower and especially on the chest.
Yeah, I think a lot of people forget about this area because I'll see sometimes they have a really perfect face, but then you'll look at their neck and their chest area and you're like, whoa, whoa, yeah, that's not good. Okay, let's talk about fat fillers. We're going to go into natural fat grafting versus off-the-shelf fillers. So what exactly are fat fillers?
Well, fat fillers, that's when we use your own fat, the patient's own fat, the natural, we call it natural fat filler. And I usually take it from the lower abdomen
Okay.
I always joke and say, patients always tell me, day before yesterday, say I didn't take enough, but I take it from the lower abdomen. We process it. We do it all at the same time. But we concentrate it. I have a machine so that we get the fat cells concentrated, get rid of the excess products and stuff, and then I use little tiny cannulas because it's little mini liposuction that I do on the tummy to get the fat, and then we use little special tiny cannulas that are blunt instead of sharp, and we use those to inject into the areas to fill the areas. It's the same. The concept is the same as Juvederm or Restylane or any of those.
Right.
The difference is that the fat, whatever's there at 4 to 6 months, it usually is permanent. It stays. Somewhere, a minimum usually of 50, it's usually 80-90% of what I inject will survive. The other kind of difference with the fat, though, is that because I have to go through the tissues more, there's more swelling and bruising. So you have a week or so of downtime with the fat. The off-the-shelf fillers, they're quick and easy. They come in a box, a bunch of syringes, and it's just question.
But we don't do those ourselves, right? The off-the-shelf ones.
I do those. Yes.
Oh, okay.
Yeah,
so you do both.
I do both, but most of the patients I see, they want an alternative to the off-the-shelf because most of the off-the-shelf they'll last, it depends on the patient, but they'll last somewhere between 9 and 24 months.
So is that the biggest difference in those, that one will last longer than the other, one's more permanent?
Well, yes, but it also helps. There's a lot of research going on right now with the fat has components to it that we don't understand completely. It actually improves the quality of the skin with time. There have been published studies that show that the overlying tissues, there's one surgeon that has photographs 12, 15 years later, and it's quite remarkable how the quality of the skin improves. So it's nice that occurs. But I do a lot of fat and or laser at the same time as I do the facelift, because most people that come in for a facelift, they might have some extra fat, weak muscles in the neck, and need some tightening all the way through here and in the neck. But they also need some filler, and so it's most common thing I do is a facelift with fat or laser or all three.
Do you recommend one over the other, or does it kind of depend on the patient, or do they ask for one specific?
Depends on the patient.
Depends on the patient?
Yeah. It's not much fun doing procedures that they don't need.
Right.
That's a little joke, but anyway, no, it's I do them together because really a lot of patients it really, I call it, they get a bigger bang for their buck. It's
by doing
either depending on the patient.
Right.
If they have a lot of sun damage, for instance, doing a laser, because the facelift's not going to get rid of certain wrinkles on the cheek, and so the laser, yes, it's more money, but it's hardly any more in terms of the downtime and the results. I'm always joke, say I'm a little biased, but I think the results are so much better when you have these. For some more money, yes, but with the fat and or laser, you improve your results a great deal.
And then what areas of the face do the fat fillers go into?
Mainly around the mouth, the lips. I've never put too much in the lips.
On the lips.
Yeah, especially.
I think that's the more popular one right now.
Yeah, well, according to my staff as well. I'm always worried I'm going to put too much in. But anyways, around the mouth, the chin, this what we call pre-jowl depressed area, But I put it in the brows, so bring the brow up. It helps that sagging brow, the upper eyelids. And then, of course, the mid-face, it brings that youthful look back to that mid-cheek, because the facelift brings up a lot, but this really helps. And so those are the most common areas that we do.
And then we'll also leave pictures in the comments below right after this of some before and after photos if you want to take a look and then ask any questions for us, and Dr. Taylor will answer them right after this segment for you as well. And then I think we went over that. Last thing we want to talk about is treatments for wrinkles and sagging eyelids. What are the options for that?
Well, again, depends on the patient. The upper eyelids, there can be excess skin. What a lot of people don't realize is that their brow is playing a role, and it creates what we call hooding. Some people need a little suspension. I don't really do that many big brow lifts anymore, but I do a suspension when we bring it up. A lot of times I'll just put filler in, to fill the brow. That helps with that. But then we take out the excess skin, the extra fat. Lower eyelids are different in that the fine wrinkles we deal with a laser. A lot of times they need a filler in an area. We don't make the incision all the way across as much as we used to. We make it mainly from the inside and take the extra fat out and spread the skin out from the inside. So it just depends. They might just need a laser, they might need filler, but a lot of times they don't need a lot of skin cut out of the lower eyelid.
So if they receive the eyelid or the eyelid lift, is that a lot of downtime that they're going to be as well?
No, the eyelids are,
or the sagging.
Surgery is always surgery, but in terms compared to a neck lift or a facelift, it's not anywhere near as much. But the downtime is usually a week or so.
What age range do you see for this procedure?
Well, that's a lower group. I mean, we see them anywhere from 35 to 55. It just varies.
The lower age range is surprising. Do our eyelids sag as we age, or is it kind of more of a genetic?
A little of both. It's the muscles and the brow, and it's the weakness, but it's also that loss of thickness and volume that we get, and so and the loss of elasticity. You lose the elastin in your skin about 1% a year or so. So it varies.
And I think we're also going to leave photos of the before and after as well in the comments. So you can go ahead and take a look at that. And then if someone wants to come in for a consultation or they want to learn more about you, how should we contact you?
Well, I have a website. It's marktaylormd.com. It's MARC.
And we'll put it up on the screen for you right now.
And then I've moved my office. I've used to be out in the Stone Oak area, and then just last 4 or 5 years I've been over at I-10 in Callahan. But we moved to the Oakwell Farms area. So
I like this office.
Yeah, I do too, actually. We're still arranging stuff. We've only been in it about 6 weeks, but it's nice. It's in the medical building in Oakwell, on Oakwell Court in Oakwell Farms. So it's been nice. We like it here. And as far as arranging consults, just give us a call. The number's 210-305-5797.
It's right there on your screen as well. Remember, don't forget to leave your questions in the comments below. Dr. Taylor will be answering them throughout the day and throughout the rest of the week for you. Anything else you want to add for us?
No.
It was fun. I learned a lot.
Well, I'm glad you did. It's been fun for me too.
Maybe I'll come in for a procedure down the line.
A facelift, it'd be way down the line.
So. I don't know, maybe some fillers.
Okay, well, we'll
talk. We'll talk after.
We'll talk about it.
Bye. Thank you.
Goodbye.